Everybody okay? I'm sorry about the weather. It feels pretty good to me. So anyway, I am currently the Extension Veterinarian with the Louisiana State Agricultural Center, and I'm here to represent the American Association of Bovine Practitioners, which is close to 5,000 veterinarians who work on cattle. But most of those veterinarians also work on other livestock species and sometimes work on small animal species too. So there's a lot of overlap with what we do. I want to thank AHI and AVMA for having me, and being up here with this esteemed panel is quite an honor. One of the things that I like to go back to routinely is the oath that we all took as veterinarians. And to go back and actually read that and look at what we actually signed on for. And part of that veterinary oath says that we are going to protect public health. And if you look at large animal practitioners and practitioners that deal with livestock species that are going into the food chain, it is what we do every day, all day, and it's in our minds constantly. Veterinarians out in the field, they'll work with large animals, deal with animals on an individual animal basis. They also have to look at populations, and those two things are very much intertwined. We have general practitioners, we have people that do just dairy, we have people that do just swine. Again, we have veterinarians who do some of everything, and especially in our rural communities. We also have veterinarians who specialize in food animal internal medicine, surgery, pharmacology. So we have specialists who do just food animal practice. When you look at the livestock species that we deal with that are going into the food chain, all of the species have quality assurance programs. So if you look, we have beef quality assurance, we have pork quality assurance, we have meal quality assurance programs. And those are very, very important programs. The basis of these programs is really to first assure food safety. So we want to have a product that is safe. Secondary to that, we want to have a product that is nutritious, that tastes good, things like that. Those programs have several components, and they're very comprehensive. Parts of them are prudent drug use, biosecurity, preventive. It's very heavy stressing preventive health, and everything the veterinarians do that work on these livestock species every day tie into those assurance programs, and making sure that, again, when we make a decision on the farm looking at one of these animals, we have to balance what's good for that animal, or what's good for that population of animals, and what's good for public health, and what's good for food safety. So those things have to be in balance, and some days that's definitely a challenge. So again, veterinarians are intimately involved in these programs, and very necessary for these programs to go forward. The veterinarians out there in the field are also really the boots on the ground for USDA, for Department of Homeland Security, so that when an emerging disease comes up, we know that we can recognize it as quickly as possible. So it's very important that these practitioners are out there in the field, they're involved in these programs, they're accredited veterinarians through USDA, and that we all work together.